Today we are going to discuss about 3 pediatric surgical topics while discussing some questions. So let's get right at it. The first case for today is a 6-year-old boy who has developed a limp and has limited mobility of the hip but denies pain and fever. So what is the diagnosis? This disease is leg Calve Perthes. Leg Calve Perthes disease is avascular necrosis or idiopathic osteonecrosis of the femoral head. Why this is happening or the cause of the disorder is unknown. Boys between the age of 2 and 12 years are most frequently affected, and the incidence in boys is greater than 4 to 5 folds than girls. Presenting symptoms include a limp and a pain in the anterior thigh, groin or knee. However, the classic symptoms include a painless limp. On examination, they'll have reduced range of movements, especially in abduction and internal rotation. This is diagnosed by doing an X-ray view, that is the anterior-posterior view and the frog lateral view. When it comes to management, the aim is to contain the femoral head within the acetabular. And since the patient is in pain, they need analgesics, bed rest, and gentle exercises are advised. To contain the femoral head, a plaster or a brace is used, and this is to maintain the hip in abduction. They can develop complications like osteoarthritis. So let's go to our next case. Our second case is an afebrile, obese 14-year-old boy who has developed a pain at the right knee and a limp. So what is the diagnosis? This is slipped capital femoral epiphysis. Slipped capital femoral epiphysis or the slipped upper femoral epiphysis, which is also known as SUFE. This is a disease of unknown etiology and occurs typically in adolescents. This disorder is most common among obese boys with delayed skeletal maturation or in thin tall adolescents having recently enjoyed a growth spurt. So it's common in boys around 14 to 16 years of age and in girls around 12 to 14 years. Onset of this disorder is frequently gradual. Pain is referred to the knee in 20% of the cases. And they might tell you about a past medical history of hypothyroidism and chronic renal failure. On examination, you will observe that these patients are usually overweight or very tall and thin. They can have a short leg with external rotation, and their range of movement like abduction and internal rotation is reduced. To diagnose, we can do an X-ray, that is the anterior posterior view and frog lateral view, or a CT scan. This disease is treated by surgery where they'll do open or percutaneous lag screw fixation. Complications of this disease are slipping of the femoral epiphysis in the opposite side, avascular necrosis of the femur, and coxa vara. Our next case is a 2-year-old who refuses to walk, has fever, has significant pain with external rotation of the right leg, and has an elevated white cell count. So what is the diagnosis? The answer is septic arthritis of the hip. Septic arthritis requires urgent intervention to preserve joint mobility. This can occur at any age or sex. However, it's very common at the extremes of age. The common sites are hip joints in neonates, knee joints in children and adults. Staphylococcus aureus is the most common organism. E. coli and group B streptococcus in neonates. Haemophilus influenza is common in non-immunized toddlers. They'll often complain of a severe joint pain and the joints will be immobile because of that. They'll also have systemic symptoms of infection like fever and malaise. And they'll complain of a recent history of infection. On examination, the joint movements are reduced and there'll be a lot of pain. And around the affected joint, they can develop features of inflammation like redness, warmth, pain, swelling, and loss of function. Joint aspiration is diagnostic and it can be helpful in the treatment. And in hematological studies, they'll have elevated white cell count, elevated CRP, and elevated ESR. When it comes to the treatment, analgesics is a must. Rest the joint and IV antibiotics are given empirically and according to the antibiotic sensitivity test. and the IV antibiotics is later followed by the oral antibiotics. These children need treatment for 4 to 6 weeks. Opening the joint span may be required in a septic hip to assist in draining purulent material. So if you have any questions, you can drop them as comments below. I'd love to hear your suggestions on how I can improve my content. I'll see you guys all next week with another interesting video just like this. Until then, take care and goodbye.